They handed the new nurse the blind ranger because they thought it would be funny. Welcome back to Quiet Badge's Stories. I'm glad you're here. Before we get into this one, if you enjoy stories about quiet people who turn out to be anything but, hit the like button, subscribe, and drop a comment telling me where in the world you're listening from tonight. I want to know how far this story travels. Now, let's go. Garrison VA Medical Center sat on the western edge of San Antonio, like a building that had given up on color. The walls were the beige of old paperwork. The floors smelled like industrial cleaner and old coffee, and something underneath both of those things that no amount of mopping ever quite reached. People who worked there long enough stopped noticing it. People who were new still did. June Hallett had been new for 22 days. She wore teal scrubs 2 sizes too big at the shoulders and kept her dark hair pinned flat at the back of her neck. She moved through the unit quietly, took the rooms no one wanted, answered questions in as few words as possible, and let people form whatever opinion they wanted about her. In her experience, invisibility was a choice. She had made it deliberately. The charge nurse was Bethany Olds. Bethany had worked Garrison's B wing for 11 years and had developed the specific confidence of a person who had confused longevity with wisdom. She wore her badge clipped high on her collar and spoke to newer staff the way some people spoke to dogs. Not unkindly, necessarily, just with the assumption that full sentences were wasted on them. On the morning of day 23, Bethany dropped a chart on June's medication cart without looking at her. Room 7, she said. Staff Sergeant Dorian Cole, retired Army, bilateral visual loss, both eyes gone from a blast about 3 years back. Admitted yesterday for fever and right leg pain. Won't let anyone examine him. Won't respond to verbal communication. Knocked a tablet off the bedside table when the intake nurse tried to use text-to-speech. She paused. We've been calling him difficult. Across the nursing station, Dr. Philip Crane set down his coffee without quite looking up from his tablet. He was the kind of handsome that had curdled slightly over time. The kind that comes from decades of people agreeing with you before you finish talking. He glanced at June like she was a scheduling problem. Parker, you handle intake this morning? Hallett, June said, and yes. Good. He looked back at his screen. Go introduce yourself to room 7. See if you can get vitals. He's been refusing everyone else. Behind the supply cart, Kevin Shea, a second-year resident who still thought cruelty passed for confidence, lifted his phone just slightly. Not recording yet, just ready. Bethany's mouth did something that wasn't quite a smile. June picked up the chart and read it on her way down the hall. Dorian Cole, 41, Staff Sergeant, 75th Ranger Regiment, retired, visual impairment, traumatic bilateral enucleation, both eyes lost in 2023 during a classified overseas operation, above-knee amputation, right leg, admitted at 800 with a fever of 101.2, right calf pain, and lower leg swelling, pulse elevated at 118, oxygen saturation 94. The red flag at the bottom of the page read, non-compliant, combative, do not approach without additional staff. June had seen that language before. It almost always meant someone had stopped trying to understand the patient and started writing the chart to protect themselves instead. She stopped outside room 7 and looked through the narrow window. Dorian Cole sat upright against the headboard with his shoulders pressed to the wall. Not relaxed against it, pressed against it, in the way that people who have spent real time in dangerous places sit when they don't know who's in the room. His hands rested on his thighs. His head was tilted slightly, chin down, which meant he was listening to everything. The 2 orderlies standing near the door were positioned badly, too close, blocking his exit route, which would read to him as a threat even if that wasn't their intention. He was not combative, he was cornered. June knocked twice on the doorframe, then paused. Not because that was hospital protocol. Because 2 knocks, then a pause, then entry was how you announced yourself without startling someone who couldn't see you coming. She stepped inside and looked at the orderlies. I've got it from here. One of them started to object. She looked at him. He stopped. They left. June moved to the left side of the bed, not the right, putting herself at his slightly stronger audio angle based on the way he'd tilted his head. She kept her footsteps even and unhurried. She set the chart down on the table, audibly enough that he could track the sound, know where she was. Mr. Cole, she said. My name is June Hallett. I'm your nurse this morning. I'm going to stay over here by the table unless you say otherwise. He said nothing. His jaw was tight. She didn't push. She pulled the rolling stool out from the corner, again audibly, no surprises, and sat down. Not standing over him, not crowding him, not performing efficiency at his expense. They put a note in your chart that you haven't eaten since admission, she said. That's about 18 hours. If you're in pain, an empty stomach makes everything worse. I'd like to get you something if you'll let me. Still nothing, but his hands shifted slightly on his thighs. June looked at his right leg. The swelling was visible even through the blanket, the way the fabric lay wrong over it. She noted it without saying anything yet. She leaned forward and rested 2 fingers lightly on the back of his left forearm, just below the wrist. Then she tapped 3 short, 1 long, 2 short. Dorian Cole stopped breathing. It was the smallest thing. His chest just stopped for 1 full second, the way a person freezes when they hear their name spoken, in a voice they were certain they would never hear again. His head turned toward her, sightless, facing her. He tapped back. A question. June answered. Confirmation. "Who are you?" he said. Not a question. The voice of a man who had learned to make statements sound like demands, so people understood he was serious. "Your nurse," she said. "That's not what I asked." "I know." His jaw worked, iron passage. June kept her face still. Under her watch, on the inside of her left wrist, a scar sat white and old and out of sight. "You need to let me check your leg," she said. Something shifted in the set of his shoulders. Not trust, exactly. Recognition, of someone who wasn't going to flinch, and wasn't going to perform concern she didn't feel. "Fine," he said. She checked the leg carefully. The calf was warm to the touch, the swelling firm, the tenderness significant when she palpated gently. His pulse at the foot was present but reduced. She listened to his lungs without asking twice, noted the mildly diminished air movement at the bases, checked his oxygen again. It had dropped to 92 while she was in the room. Fever 101.2, pulse 118, oxygen 92 and falling, right leg swelling with tenderness and warmth, recent immobility post-admission. She knew what she was looking at. She went back to the nurse's station and found Bethany at the desk. "Room 7 needs a D-dimer and a right lower extremity ultrasound. I want to rule out DVT and pulmonary embolism." Bethany looked up slowly, with the expression of a woman who had decided years ago exactly where the borders of other people's competence ended. Dr. Crane already ordered a CBC and metabolic panel. "That's not what I'm asking for." Dr. Crane materialized from the physician workroom the way people like him always did. At the exact moment a smaller person was making a point. He looked from Bethany to June with mild irritation. "Anything I need to know." "Room 7, June said. Right leg swelling, warmth, tenderness, oxygen dropping. He's been bedbound since admission. I want DVT imaging." Crane's expression was patient in the way that was actually dismissive. "He's agitated, elevated pulse, shallow breathing, recurrent non-compliance. That presentation is anxiety, Hallett. Classic hypervigilance in combat veterans. His leg is warm and swollen. Soft tissue response to stress. He was already turning back toward the workroom. Continue the acetaminophen. Document his behavior. If he'll accept the meal tray, encourage him to eat." Behind the supply cart, Kevin Shea had not put his phone away. June looked at the chart in her hands for 1 moment, then she walked back to room 7. She sat down on the stool again. Dorian Cole's oxygen read 91 on the pulse oximeter she'd clipped to his finger. "You're getting worse," she said. "I know," he said. "The attending wants to call it anxiety." The slight flattening around his eyes that weren't there anymore, said everything. "I disagree with that assessment," June said. "I'm going to document everything I observed, every number, every sign, and when it gets worse, I'm going to call the rapid response team myself." "They'll fire you." "Possibly." Cole was quiet for a moment. "You were a medic." June didn't answer. Iron Passage had one medic who knew the tap code 1. His voice was even. "They told us she died on extraction." People get told a lot of things. The oximeter read 90. She stepped to the door. "Bethany, I need you in room 7. The oxygen dropped to 88 in the 4 minutes it took Dr. Crane to respond to her page. By the time he arrived at the doorway, Cole's pulse was 132 and his breathing had shallowed noticeably, the right chest moving less than the left. "Anxiety response," Crane said, not entering the room. "His oxygen is 88, June said. "He's hyperventilating." "He's not hyperventilating. His respiratory rate is 20. His effort has increased. That's not the same thing." She kept her voice flat, not angry, flat. "He needs a chest CT and lower extremity Doppler now." Crane's voice cooled. "You are a floor nurse with 3 weeks on this unit. You do not order imaging." "Then you order it." "I have ordered what is clinically indicated." "His oxygen is 87. The number hung in the air between them. Crane's eyes moved to the monitor, then away. "Continue oxygen supplementation," he said. "I'll reassess in an hour." June hit the rapid response button before Crane finished his sentence. The announcement broke through the ward the way those announcements always did. Unavoidable, absolute, carrying the specific weight of a situation that had just stopped being routine. Crane spun toward the call panel. "Cancel that." "No," June said. Kevin Shea's phone at the nurse's station had gone dark. His face had gone a different kind of dark. The rapid response team arrived in 90 seconds. Dr. Vivian Morse, lean and fast, stethoscope already in her ears, came through the door first and went straight to Cole without introducing herself to anyone. She listened, she moved the stethoscope, she listened again. Right lower lobe is diminished, she said. She looked at Crane. When did this start? He's been non-compliant since admission. I'm asking about the breath sounds. Crane said nothing. Vivian looked at June. History? June gave it in 45 seconds. Vitals on admission, progression, leg findings, timeline, her assessment. Clean and fast. Vivian's head was already moving toward the door to call for imaging. Crane put his hand on the doorframe. I have not authorized. Step back, Philip. Vivian didn't look at him. I'm authorizing. The portable ultrasound confirmed a deep vein thrombosis in the right popliteal vein within 8 minutes. The CT which Vivian called for over Crane's audible objection, in front of 3 residents and 2 nurses, showed bilateral pulmonary emboli, small, caught early enough to treat without intubation, barely. June stood where Cole could hear her. She didn't perform calm, she didn't feel. She just stayed in the room while the team worked, and every few minutes she said, quietly enough that only he could hear, still here. When his oxygen stabilized at 95 on supplemental flow, and the anticoagulant drip was running, and the room had thinned to essential personnel, Cole said, "They're going to come after you." "Probably," she said. "You knew what this was from the moment you walked in." She didn't deny it. "Crane will say you escalated inappropriately." His voice was careful, quiet, that you were pursuing attention, that the outcome would have been the same without you. The outcome would not have been the same without me. Cole's hands rested still on the blanket. Then he said something quiet enough that the nurse behind her didn't hear. "Ridge calling anchor. Come in." June's jaw tightened. "Still here," she said. Same words, different meaning. The administrative conference room smelled like recycled air and the particular anxiety of people who managed liability for a living. Frank Sutter, the hospital administrator, sat at the head of the table. Dr. Crane sat to his right with a folder, and the expression of a man who had decided the best defense was to arrive first. Kevin Shea sat beside him with his hands clasped and his eyes down. Bethany Olds sat near the door. She had not looked at June since the rapid response call. "Nurse Hallett," Sutter said. "You activated rapid response without physician authorization." "I activated rapid response when a patient's oxygen dropped to 87 and the attending declined to reassess." Crane leaned forward. "You countermanded a direct clinical order." "I escalated a deteriorating patient. That is within nursing scope in a life-threatening situation." Sutter wrote something. Dr. Crane's clinical assessment was incorrect, June said. The CT confirmed bilateral PE. The Doppler confirmed DVT. The patient was 40 minutes from a potentially fatal outcome. I have documented every vital sign and every clinical decision made in that room, including who was asked for imaging and when, and what response was given. Silence. Sutter looked at Crane. Crane's expression had moved through several phases and arrived somewhere between controlled and afraid. "There's a secondary concern," Sutter said. He glanced at Kevin. Kevin looked at his hands. "Staff report that the patient responded to you in an unusual way, that you used some form of communication no other staff member recognized." "He trusts me," June said. "Sometimes that's what happens when you treat someone like a person." Crane opened his folder. "Mr. Cole has been flagged for behavioral concerns. There are questions about how you gained access to him when no one else." "He wasn't combative," June said. "He was scared and alone in a room with people who couldn't communicate with him and wouldn't try. That is not the same thing." Bethany Olds looked up from the table for the first time. The door opened. Dr. Vivian Morse walked in with Cole's updated report and the expression of someone who had come specifically to put it on the table. She placed it in front of Sutter without greeting Crane. "Bilateral PE, right lower DVT, now appropriately anticoagulated, oxygen stable. Had Nurse Hallett not activated rapid response, we are looking at a possible cardiac arrest within the hour." She straightened. "I'll defend every clinical decision she made. Everyone." Crane began to speak. The door opened again before he finished. Dorian Cole stood in the doorway. He had his white cane in his right hand and his left hand on the door frame. The step-down nurse behind him looked like she'd tried to stop him, and understood very quickly that she wasn't going to. He was in a hospital gown with IV lines still running, and he was standing straighter than any man with bilateral PE and a right leg amputation had any business standing. The room went very quiet. "Mr. Cole," Sutter said, "you need to return to your room." Cole's head turned toward the sound of June's breathing. Not her voice, her breathing, and oriented on her exactly. "She saved my life," he said. His voice was steady. "I want that in whatever report this is." June moved toward him. "You shouldn't be standing." "I know." He didn't sit down. "I want to hear what they say before I do." Frank Sutter looked at the man attached to an IV line standing in the conference room doorway and made a calculation. "Mr. Cole, we appreciate." She activated the response because the doctor told her it was anxiety. Cole's voice didn't rise. "I'm a ranger. I've been managing other people's assessments of my reactions since I came home. I know the difference between anxiety and not being able to breathe." She knew it too. "The only reason I'm standing here right now is because she didn't wait for permission to keep me alive." No one spoke. Crane's folder sat closed on the table in front of him. "Whatever you're deciding," Cole said, "decide it with that." He let June guide him back out. In the hall, leaning on his cane, he said very quietly, "Iron Passage, Kabul Sector, the Forward Aid Station, 2022. "Don't," she said. "You came back for Reyes when the extraction failed. Rise came home. Rise came home because you went back through an active fire zone with a medical pack and no cover." His jaw worked. "They told us you didn't make it out." June kept walking beside him. "I made it out." "They sealed your records." "Yes." "Why?" She didn't answer for a moment. Then, "Because what I did before I went back in would have been inconvenient for some people." Cole said nothing. The hall monitors beeped their steady cadence. Somewhere at the far end of the wing, a television played a game show with the volume too high. "There's a man," Cole said quietly, "who has been trying to get access to me since I was admitted. He showed up at the prosthetics clinic last month. I thought I was being paranoid." June stopped walking. "He works for a contractor," Cole said. "Vectis Medical Solutions. They've been billing the VA for prosthetic components that don't meet spec, overcharging, substituting inferior parts, falsifying inspection records. I have a full report, names, contracts, it's on a drive I brought in with my gear." "Where is it?" "Field notebook, left front pocket of my duffel," he paused, "or it was." June's eyes moved down the hall. A man in a maintenance jacket stood near the supply alcove. His badge faced away from her. His shoes were wrong. Clean soles, no wear marks, the specific wrongness of someone who had dressed for a role they hadn't rehearsed long enough. She had seen that kind of wrong before. "Room," she said, "now." She got Cole into the step-down bed, pulled the curtain and went to the nurse's station. "Bethany." Her voice was low. "Lock the storage room adjacent to the prosthetics corridor. Do it now and don't explain it to anyone." Bethany looked at her. Something had changed in Bethany's face since the conference room. Not warmth. Something more honest than warmth. "What's happening?" "Someone is in this building who shouldn't be." Bethany moved. The overhead PA crackled 15 minutes later. "Code Silver. Security response requested." And then, from somewhere near the south stairwell, a shout, and then the specific sound of something heavy falling. The lights shifted to emergency red. June closed Cole's door, moved the recliner, heavy, awkward, against it at an angle, and picked up the IV pole the way she had picked up longer things in darker places. "Cole from the bed. How many?" "2 that I've seen." "The one by the supply room was waiting on a signal," he said. "He's the secondary." June looked at him. "I'm blind," he said, "not deaf. The man by the supply room had a 2-way. He said the word confirm 11 minutes ago. I heard it from the hall." June stood very still. Where did his voice come from? Down from the left, about 40 feet. She moved. Dane, the federal officer who had arrived with Colonel Weiss 3 hours ago without announcement, and was currently in the waiting area reading Cole's medical file, took the adjacent position when June signaled from the doorway. She didn't explain. He followed, because something in the way she moved left no room for hesitation. The secondary was in the stairwell access corridor with Cole's duffel bag unzipped at his feet. He had the field notebook in one hand and a phone in the other, and he didn't hear June until she was 4 feet away. Because in the emergency lighting and the noise from the lobby, 4 feet was how close you could get if you moved correctly. He reached for the notebook. She was faster. Dane handled the rest. She was already walking back. In the red-lit hallway, Colonel Aaron Weiss stood outside Cole's door with his arms crossed, and the expression of a man who had suspected this moment was coming and hadn't known when. "Hallett," he said. She handed him the field notebook. "Chain of custody starts now." He looked at her for a long moment. "How long have you been here?" 23 days. "And Cole?" "He came to me. I didn't know he was here until I walked into that room." Weiss looked down at the notebook. Vectis Medical Solutions. Names, numbers, dates going back 4 years, 2 VA facilities, 11 contracts, 1 physician's signature appearing 3 times. Dr. Philip Crane. The formal review happened 4 days later, in a room with better lighting and more chairs. Sutter was there. Weiss was there. 2 federal investigators with laptops and lanyards. Vivian Morse sat in the corner with her own copy of the clinical record. Bethany sat one seat away from Kevin Shea, which was as far from him as the table allowed. Crane had been placed on administrative suspension pending federal review. Kevin Shea provided a voluntary statement that morning. His voice, when he read it aloud at Weiss's request, was not steady. Crane had told him that June was disrupting patient care, that Cole was a liability, that documenting certain findings was not in anyone's interest. Kevin had believed it because Crane was who Crane was, and Kevin was who Kevin was then, a person who wanted to belong badly enough to become useful to the wrong person. "I'm sorry," Kevin said, not to the table. June said, "Carry it carefully." He nodded like he understood it would take a while. When Weiss read June's full record into the room, Sergeant First Class June A. Hallett, 18th Special Forces Group, Medical Sergeant, callsign Anchor, Silver Star, 2 Purple Hearts, medical separation under sealed status following Operation Iron Passage. The room absorbed it the way rooms absorb things that reorder everything that came before. Sutter looked at the badge clipped to her scrub jacket. June Hallett RN, no rank, no commendations. Nothing that had drawn attention for 23 days. "Ms. Hallett," he said, "this hospital owes you." "Policy," she said. He stopped. "Not an apology. Policy." She looked at the table. "Every blind and low-vision veteran admitted to this facility gets a qualified orientation and mobility consultation within the first 2 hours. No patient gets labeled non-compliant until staff have documented at least 2 attempted alternative communication methods. No nurse is disciplined for activating rapid response in a life-threatening presentation, regardless of attending instruction. Those are my terms." We said, "Those are reasonable terms." Sutter nodded, then after a moment approved in writing. Vivian Morse caught June's eye across the table. She didn't smile. She nodded once, the way people nod when something has finally been done right. Bethany Olds found June in the medication room that afternoon. "I started it," Bethany said. "The assignment. I thought it would." She stopped, started again. "I thought he would refuse you and we'd have a reason to write you up and move the performance review along." June waited. "I was wrong," Bethany said, "about what I thought was going on and about what I thought was okay to do." She looked at the supply shelves. "I don't expect anything from that." "Good," June said. "Figure out what it changes in how you do things. That's what matters." Bethany left. June stood in the medication room for a moment alone. Not for long, patients didn't wait. 6 weeks later, Garrison VA's B Wing had a new communication protocol board outside room 7. Kevin Shea was in a remediation program that he had, by all accounts, taken seriously enough to stay in. The Vectis contracts had been suspended pending federal review, and the names in Cole's field notebook were moving through a process that was slow and unglamorous and, as Weiss had put it, absolutely certain. Crane's portrait was gone from the physician recognition board. No one mentioned where it went. On Cole's discharge day, June walked him to the lobby. He had a new prosthetic fitting scheduled, different clinic, different vendor, and a referral to a low-vision specialist who actually knew what she was doing. He moved with his cane the way people move when they have made peace with moving differently and aren't interested in pretending otherwise. At the lobby doors, he stopped. "You staying?" he said. June looked back at the ward. Bethany was at the nurse's station, working carefully through a chart. An elderly veteran in room 3 had been waiting 3 days for someone to read his discharge instructions to him, because no one had thought to ask whether he could read them himself. June had asked that morning. "For now," she said. Cole's mouth did something quiet. "I'll be at the outpatient clinic Tuesdays and Thursdays, for the fitting." "I know the schedule." "I know you know," he paused. "I'm saying I'll be there." She let that sit where it was. It was enough. She watched him go through the lobby doors, cane tapping the familiar rhythm of someone who had learned to trust sound over sight. Then she turned and walked back into the building. Her badge caught the fluorescent light as she passed under it. June Hallett, RN, no call sign, no rank, no history that anyone looking at it would see. The veterans in the lobby chairs watched her walk by. An old Marine touched 2 fingers to his cap. A Vietnam-era veteran with a cane gave her a slow nod. A young amputee near the elevator said, without looking up, "Cole doing okay?" "He's doing okay," she said. "Good," the young man said. Somebody finally listened to him. June kept walking. She had 3 patients waiting and a documentation backlog and a new communication protocol board to check before the end of her shift. The lobby returned to its ordinary noise behind her, the too loud television, the coffee machine, the low hum of people waiting. She had not come back to be seen. But sometimes the people worth protecting find you anyway, and sometimes the only thing left to do is step forward and do the work, quietly, the way you always have, because the work doesn't care what name you're using. It just asks whether you'll show up. She showed up every day. That was always enough.